The first 100,000 doses of the Mpox vaccine have arrived in Congo's capital. This delivery comes 3 weeks after the World Health Organization declared Mpox outbreaks in 12 African countries a global emergency. The vaccine, known as 𝗗𝗄𝗃, was donated by the European Union through 𝗗𝗶𝘀𝗶𝗺𝗃, its health emergencies agency. Another 100,000 doses are expected to arrive on Saturday. UNICEF will oversee the vaccination campaign in the hardest-hit provinces, Congo's Health Minister 𝗗𝗶𝘀𝗃𝗃 announced. However, the start date for the vaccination drive is still unclear. Western partners, including the European Union and the United States, have promised about 380,000 doses of Mpox vaccine. This is less than 15% of the 3 million doses needed to control the outbreaks in Congo, which is the epicenter of the global health emergency. Since the beginning of 2024, Congo has reported over 4,900 confirmed Mpox cases and more than 629 deaths. Most of the cases are in children under 15. These vaccines are crucial for protecting health workers and vulnerable groups and for stopping the spread of Mpox, said Dr. 𝗗𝗶𝘀𝗰𝗹𝗶𝗺𝗿 from the Africa Centers for Disease Control and Prevention. Following the global Mpox outbreak in 2022, wealthy countries quickly provided vaccines and treatments from their stockpiles. However, only a few doses have reached Africa despite urgent requests from its governments. The 𝗗𝗶𝘀𝗶𝗺𝗏 vaccine, which is already used in Europe and the United States, is approved for adults. The European Medicines Agency is reviewing data to possibly extend its use to children aged 12 to 17 by the end of the month. 215,000 doses were specifically pledged and purchased for Congo. 𝗗𝗶𝘀𝗰𝗹𝗶𝗺𝗏 from 𝗗𝗏𝗃𝗏𝗃 from the Red Cross both noted that while the vaccines are welcome, the amount is still far below the need. Experts predict it will take weeks before vaccines are administered due to financial and logistical challenges in Congo's vast and resource-limited health system. Last week, the U.S. donated 10,000 doses to Nigeria, where Mpox is also a concern. Nigeria has reported 40 cases of the virus this year. Mpox, also known as Monkeypox, had been spreading quietly in Africa before the 2022 global outbreak. Dr. 𝗗𝗶𝘀𝗃𝗃𝗃𝗃 from WHO noted that the current situation in Africa is different from the 2022 outbreak, which mainly affected gay and bisexual men. Now Mpox is also spreading through close contact among children, pregnant women, and other vulnerable groups. Most people over 50 were likely vaccinated against smallpox, which might offer some protection against Mpox. However, Africa's younger population is largely unprotected. The Africa CDC is working on a unified response plan for the outbreaks, which will be presented to African leaders at a meeting in September. And that is it on our latest update on the Mpox. If you find this information helpful, don't forget to hit the subscribe button and notification bell for more updates. And if you have not subscribed, you may not see us again. Thanks for watching.